Thank you for joining us for today's ASPPH Presents webinar, CDC Public Health Associate Program, PHAP, and Best Fit Candidate Model Overview, co-sponsored by the Centers for Disease Control and Prevention. This webinar is part of the ASPPH Presents monthly series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation, but may address a few burning questions throughout the webinar. This webinar is being recorded and it will be available on the ASPPH website soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit, and you will find in the handout section of your GoToWebinar docking station 4 handouts available to you immediately, and one of them is the PowerPoint slide deck. Our speakers today are JT Theophilus and Nikki Ross. JT is lead for the Partnerships and Stakeholder Engagement team with PHAP at CDC. He leads stakeholder engagement activities across all CIOs within CDC, as well as external partners with PHAP. He has experience working in HIV prevention services in community-based organizations and at the state level. He has a clinical degree in rehabilitation medicine and has experience with the clinical management of chronic diseases, including stroke prevention, heart disease, obesity, and wellness programs. Prior to joining the management team for PHAP, he worked in preparedness in support of the integration of the Public Health Emergency Preparedness and Hospital Preparedness Program Cooperative Agreements. JT served as the deputy for the vaccine implementation team during the H1N1 outbreak and has served on a number of inter- and intra-agency work groups across CDC and HHS. Nikki Roth is also a member of the Partnerships and Stakeholder Engagement team with PHAP at CDC. Nikki is a recent graduate of the Rollins School of Public Health at Emory University with a focus in epidemiology. During her time as an MPH student, Nikki interned at the CDC Dengue branch in Puerto Rico, working on a chikungunya and dengue-related activities. Prior to her MPH, Nikki completed a Bachelor of Science in Biology at Pennsylvania State University. Thank you for your time today, JT and Nikki.
Great. Thank you, Sarah, for your introduction, your kind words. Welcome to everyone. This is JT. I'm very happy to be part of this experience and sharing a little bit about the Public Health Associate Program, or PHAP, at CDC. This is a wonderful opportunity that we're happy to make available to you as academicians and administrative directors of schools and programs in public health, and helping really identify those best candidates that would excel in PHAP as a 2-year training program. We'll talk a little bit about the mission of PHAP. We'll describe a little bit of the life cycle of PHAP, what kind of characteristics we're looking for specifically in candidates, so you understand what the best fit model is, and in turn can go back into your potential pool of candidates for PHAP and really help us identify who might be the most appropriate and the best fit candidates to apply to PHAP. We'll talk this afternoon about some of the statistics over the last few years. You'll get an idea of the volume of applicants that we have. You'll come to quickly realize that additional applicants just to have an interest in PHAP are not what we're seeking. What we are seeking are those candidates who really would excel in PHAP, and that PHAP would really serve as the best next step in their career based on some of the characteristics we'll talk about today in PHAP. I'm going to turn it over to my colleague Nikki Roth and have her do some introductory comments. We'd like to get an idea of your experience and exposure to PHAP through a quick survey. So if you are at a computer dialed in, if you can make sure that your mouse is readily available to you, we'll give you a little overview of PHAP, and then we'll talk specifically about the best fit model characteristics. So I'll turn it over to my colleague Nikki Roth. Nikki?
Thank you, JT. Hello and welcome, everyone. And thank you to ASPPH for inviting us to share the PHAP and Best Fit Model overview. We're excited to share this program so you may identify potential PHAP candidates and encourage them to apply to the program. We want this to be an engaging and interactive webinar. So before we get started, let's begin with a polling question. What is your knowledge level of PHAP? Please select the response that best fits your knowledge of PHAP. Your options are, I have no knowledge of PHAP, I have heard of PHAP, I have some knowledge of PHAP, or I am well informed of PHAP. We will give everyone a few moments to select their response. All right, it seems like the majority of our audience has no knowledge of PHAP, so this will be a great webinar for everyone to get informed about the best fit candidate characteristics. Now we will continue with our session. Sarah, if you could take us back over to the webinar, thank you. Let's begin by going over the session objectives. Upon completion of this webinar, we would like participants to be able to identify the mission of PHAP, describe the history of PHAP, list at least 2 of the 3 goals of PHAP, name at least 3 characteristics of the typical PHAP candidate, and identify the phases of the PHAP application cycle. First, let's talk a little bit about the mission of PHAP. There are 3 main components of the PHAP mission we like to focus on. The first of these components is to provide experiential, hands-on learning. PHAP is meant to serve as a training program. 93% of the training for the associate is experiential and 7% is academic. The second component of the mission focuses on training entry-level, early career public health professionals. The third component of the mission is to contribute to the public health workforce. We expect the associates to help meet the overall mission and vision of the host site. Now let's look at the history of PHAP. PHAP was piloted in the state of Florida in 2007 based on the need for support of STD and HIV prevention services. The program started with 10 associates. In 2008, it more than doubled to 27 associates. In 2009, the program did not bring on any associates as funding for PHAP was diverted to support the H1N1 response. In 2010, PHAP expanded from a pilot program to a nationwide public health training program and hired 65 associates. You can see the increase in growth over the last 4 to 5 years. In October of this year, we brought in 208 associates. What is the Public Health Associates Program? This is a 2-year paid competency-based training program. Associates coming into the program have little to no public health experience. They are often new graduates of master's or bachelor's degrees with little to no professional work experience. The 2-year training assignment is in one categorical program focus area for the duration of the assignment. Associates accepted in the PHAP are federal government employees for the duration of the program. Associates are expected to adhere to the federal government standards and guidelines, ethics and practices, the same as any other federal government employee. PHAP is a significant partnership and collaboration between CDC and our partners. We partner with state, tribal, local, and territorial health departments, as well as non-governmental organizations who apply, are accepted, and matched with an associate. PHAP is also a significant partnership and collaboration between CDC, the associate's CDC supervisor, and the assigned host site supervisor. For the goals of PHAP, we use a 3-legged stool approach. The program has 3 primary goals. The first goal is to match associates with host sites that can provide work activities and opportunities for the associate to attain the PHAP competencies. The second goal of PHAP is to provide associates with experience in public health programs and service delivery. The associate will have hands-on learning opportunities in public health programs. The third goal of the PHAP program is for associates to provide an added value to their host sites in order to meet the organization's programmatic goals. If we see an associate is getting a great experience, but host sites are spending too much time with the associate, then the stool is not level. As we mentioned, PHAP is a competency-based training program. The work activities and assignments will provide opportunities for the associate to meet the PHAP competencies. The 9 PHAP competency domains are analytic and assessment, public health science, program planning, management and improvement, public health policy and law, professionalism, communication, diversity and inclusion, community dimensions of public health, and financial planning and management. There are a number of sub-competencies in each competency domain. This allows the associate to develop his or her skill set. Let's talk a little bit about what PHAP is not. PHAP is not an internship program. The responsibilities of the associate are predefined. The work assignments and activities are submitted and approved prior to the associate's arrival at the host site. PHAP is not an administrative staffing program, although some activities may involve an administrative component. PHAP is not a federal government employment service. This is a 2-year competency-based training program. While we do link associates with job opportunities, we do not guarantee job placement after graduation. Associates are also not subject matter experts from CDC. They are entry-level, early career public health professionals in a training program. PHAP has 4 minimum candidate application requirements. Candidates must have earned at least a bachelor's degree from an accredited 4-year college or university. They must have at least a 3.0 grade point average on a 4.0 scale. Candidates must be within 2 years of receiving their most recent degree, and they must be a U.S. citizen or permanent resident. In 2014, we received 3,115 candidate applications, but accepted 145 associates, which is an acceptance rate of 4.7%. We received 3,160 candidate applications in 2015 and accepted 208 associates, which is an acceptance rate of 6.6%. As you can see from this information, our focus is not to increase the quantity of candidate applications. Instead, we are looking to increase the quality of candidate applications by communicating the best fit candidate characteristics for PHAP. JT, you developed the best fit model to identify characteristics of the ideal PHAP candidate. At this point, I'd like to turn it over to you to describe the best fit candidate characteristics.
Great, thank you, Nikki. One quick clarification, I was one of many people that developed the best fit model, so I will not take full credit for work that was a collaborative effort, but thank you very much anyway. Let me reiterate a couple of very important parts. Before we get into the best fit model, some of the major characteristics to walk away with from PHAP is that A, as Nikki mentioned, this is a training program. This is entry-level, early career, public health professionals that are new into public health workforce with little to no work experience. They will have the minimum criteria to apply, as Nikki went over, to actually complete the process. It's a multi-step process that we'll talk about before the end of our hour together, but this is a training program. It's not an employment service. It's not an employment program. There is no guarantee for work afterwards, but we do hope that the associates have opportunities to meet the competencies of the program by the experience that they'll get at their host site duty station or the city and state where they will actually be doing the work at the state, local, or tribal or territorial levels. Let's go ahead and talk a little bit about the best fit model. And this was a collaborative effort amongst many of us here at PHAP with input from actively enrolled associates, alumni that have graduated from the program, taking into account, asking them, you know, PHAP is a very specific kind of program, as is the federal government. This is a wonderful, wonderful opportunity for the right candidates. This is not a program that is an opportunity for all folks that are eligible to apply. Some people will look at this program and say, I love the program and it speaks to them and it really does fit their need for their professional and personal development. Others might look at it as a different opportunity that will meet their professional goals. However, the characteristics of an individual who will succeed in PHAP are usually very clear, and this is what entails the best fit model. We'll talk about each of these characteristics in particular, but we go through the acronym of B as a big picture thinker, the E being an effective communicator, not only in written word, but in oral communication as well. The S being socially and culturally inclusive. Nikki mentioned the 9 core competencies. One of those is social and culturally inclusivity. PHAP is a very dynamic program, so the associate that will succeed in this program really should thrive in a dynamic environment. We'll talk about F, flexibility. PHAP as a federal program and a training program has many, many loops and hoops to jump through that will require individuals to be very flexible in the process. Obviously, the criteria that Nikki went over is I of intelligence. They have to have a proven record of academic success prior to coming into the program. And T, the last T, is tactile learner. They really do get hands-on. As Nikki mentioned, they'll receive 93% of their training through PHAP in the actual hands-on learning aspect. The other 7% will be academic through long-distance learning, in-person led trainings that they'll come back to Atlanta, trainings that they will have to go through to ensure that they meet all of the competencies of the program and become true generalists in public health. We're not going to train them as subject matter experts in their program focus area, but the goal is that they have transferable skills upon graduation that they can then really focus in on what areas of public health or healthcare that they have an interest in, whether that is going back to graduate school, taking a job with the federal government, at the state level, at the local level, an NGO level, et cetera. So let's talk a little bit more in detail about the first letter in the acronym, B standing for big picture. Really what we look for is we expect candidates to understand the bigger picture of public health in their own professional landscape as well as their own personal view and vision of public health. They will be matched with a location or what we call a host site at a city and state in the United States or the U.S. territories that will be focused on a specific area, whether it's environmental health, maternal child health, HIV, STD, or TB prevention, public health emergency preparedness, a variety of different public health focus areas. They have to understand that that is a small segment of public health, that the skills and the experiences that they will get during their 2-year training will provide them with transferable skills, but they will come out as a public health generalist. They'll understand principles of surveillance and epidemiology and laboratory services. They will not be subject matter experts in those areas. What they'll do is they have to understand to see the bigger picture and to be able to glean from their experiences how that may translate to them in the bigger picture of public health. So if we look at somebody who's got a very myopic vision of I want HIV or STD prevention, that individual is probably not a good match for PHAP. And we'll tell you why. It's because the matching process takes into account the needs of the host site, some characteristics of the desires of the associate or the candidate, but program focus area is not one of them. The geographic distribution of where they may relocate will take into consideration. The needs of the host site as far as their application to us will constitute where they see they have a need for supplemental support and where they can provide a good teaching and training experience for the associate. So someone who specifically wants a program focus area, PHAP's probably not a good match. We will not guarantee that they will get any specific program focus area, as that is based on the needs of the host sites who apply to host an associate each year. They have to understand that their work in public health fits into the broader picture of public health. They may have certain tasks that may seem mundane or may seem somewhat senseless or useless, but in understanding the big picture and the value of their input into public health is going to be a real characteristic that would help add value to the associate's experience in PHAP. They're, again, as we said, they're coming out as public health generalists. They're not subject matter experts. After graduation, they're free to pursue any specific program focus area that they have an interest in, knowing that the skills that they'll acquire through PHAP are really transferable and that they can transfer into any public health focus area after graduation. So that's the B of big picture thinker. Let's move on to the E of the best fit model, and that really stands for effective communicator. The communication process and the systems of communication are critical and paramount for the success of an associate. We expect them to have the capacity to be effective communicators using the written word. We expect them to be effective communicators using oral communication skills. They should be able to communicate ideas and share information accurately, concisely, succinctly, being able to modify their communication style to the level of the audience or the participants, and being sensitive and aware of their communication style is paramount. The actual process for which we look at candidates who are applying to the program includes aspects of evaluating their written words and the capacity for them to respond to certain questions using written communication. It will also include a component of a personal interview. We used Skype last year for the first time in the federal government across a number of applicants that provide us with good information on how a candidate will communicate using oral communication skills. So the E is effective communicator both in writing and oral communication skills. Let's move on to the S of the best fit model. It stands for socially and culturally inclusive. Nikki mentioned this earlier with looking at some of the core competencies of the program and areas that we've identified through a significant analysis and input from our stakeholders and a variety of input on what are those characteristics that an associate should have to help meet the core competencies. Public health professionals, as we know, work in a variety of different focus areas and will work with individuals across the United States with different cultural and social backgrounds. They've got to have the sensitivity to work with individuals of different ages and races and backgrounds, religious views, ethnicities, sexual orientation, philosophical views, even individuals who may look and sound and be the close age to them but have very different views politically or socially or philosophically. To be able to be sensitive to that and really focus on the work at hand and look beyond those potential differences in physical characteristics or social or cultural differences. They should be respectful of those differences and really embrace those differences and really be free of acting on any internal prejudices or bigotries that they may have and be able to provide an unbiased, tolerant acceptance of others throughout their working relationships during the program. Keep in mind individuals that you work with through your academic programs in schools and public health may have spoken their social and cultural inclusivity, but you may see behaviors that are not consistent with that. We really want you to focus on those individuals who you see fitting into this best fit model, especially looking at social and cultural inclusivity. So that's the S of the model. Move on to the first T of best fit model. As we mentioned earlier, PHAP is a very dynamic program, so we're looking for candidates who really do thrive in a dynamic environment. Those individuals who really do excel in environments that are not chaotic necessarily, but really do thrive that when there is a change, they embrace the change. They understand the elements and the variables that go into the changes that are affecting them, and they really do thrive in that. The Public Health Associate Program is really a fast-paced, responsive work environment when they're in the field as federal assignees. As Nikki mentioned earlier, these individuals are federal government employees, but they're placed in cities and states across the United States and the U.S. territories, so they are far away from Atlanta perhaps where their headquarters are based, and they will be in a variety of different locations, some at the state health department, some at the local health department, a city health department, some perhaps at an American Indian Alaska Native location or a tribal entity or reservation, a U.S. territory, and they may have a significant need for some additional staff in a very, very dynamic environment. Priorities may change. There are events that take place day to day in different organizations that the associate should really be able to adapt fairly quickly and really apply lessons learned and take a scientific approach and a scientific look and modify his or her behaviors on a day-to-day basis to respond to those changes. They've got to participate as part of a team, and frequently their roles may change within the team, even though, as we mentioned earlier, the host site will provide a concrete work plan of activities that the associate will be doing over the 2 years, therefore in line that this is a training program, not an internship, but some of those events will change. Okay, we're faced with natural disasters or human-induced disasters that may draw the attention of the host site supervisor and the host site staff, including the associate, into a different area. So someone who's able to adapt to that dynamic environment will thrive in PHAP. Those individuals who have less of the capacity to pursue that and to advance and to really embrace that change may struggle through PHAP. It may be an experience that they will learn from, but they might not be the ones who are a best fit for PHAP. If we move on to the F of best fit, it stands for flexible. This really is an all-encompassing term that takes into account the fact that, A, the federal government, this is a training program with the federal government, and many systems and processes take time. They are sometimes not on the spur of the moment. We'll talk a little bit about the application process for an associate and a candidate, so you have an idea of the time frame it takes from beginning the process through potentially when an associate will begin the program. We ask for flexibility, the ability for them to adapt quickly to a change and really come out of that with a positive attitude is key. Candidates have to be able to function despite the fact that there might be some uncertainty and that they're frequently changing working conditions, as we talked about, with thriving in a dynamic environment. Individuals who like to have a clear-cut set of expectations and fulfill those every day and know that they'll come in at 8 and leave at 4:30 and have their 30 minutes for lunch and will know what to do day after day after day, and will know what to do for the next 2 years, probably will not do well in PHAP. The program itself starts off in January, the application process. They sometimes will not know until late August, early September where they will be placed and where they will actually be going. So it's somebody who is flexible, can adapt to those kinds of changes quickly and maintain a positive attitude will really do well in the program, and that's what we're looking for. Okay? The I of best fit stands for intelligent. This is one of the 4 requirements to apply to PHAP, is that the individuals have a minimum of a bachelor's degree. As Nikki mentioned, some of our candidates, I think this past year, we had upwards of 30–35% of our class that came in this past October had master's degrees. We even have candidates who have PhDs. We have some medical doctors that are foreign trained that come into PHAP. This program, at a minimum, based on the hiring mechanism through the federal government called Pathways for Recent Graduates program, requires that the associate have at least a 4-year degree or bachelor's degree from an accredited college or university. Okay? Many of our candidates, like I said, may come in with master's degrees in public health or another focus area, but the requirement is that it is a minimum of a bachelor's degree with from a 4-year accredited college with a minimum of a 3.0 grade point on a 4.0 scale. So based on their demonstration to meet those 2 requirements, they will have demonstrated the capacity to learn new skills and acquire new information, therefore meeting the I of intelligent for the best fit model. They've got to be able to comprehend and apply new information and really apply that information. PHAP is a hands-on program. It is a program where associates will be out there actually working within the community. They're working with collaboration with partners. They'll be collecting water samples and air samples. They'll be doing outreach and disease investigation. They'll be working with epidemiologists and scientists and potentially laboratorians throughout their 2-year experience. So they really do have the capacity to translate what they've learned academically, if they do have academic background in public health, whether an undergraduate degree or a graduate degree, and really apply that. We have some candidates that come into PHAP that have no public health experience or background. They have no degree in public health, whether it's undergraduate or graduate degree, and excel at PHAP. And why do we see that? Well, number 1, we see that they meet these characteristics of the best fit model. Number 2, they have the passion, they have the desire, they have the interest in giving back to the community and working in public health. Many of them obviously will have some exposure to public health prior to coming into the program. Some of them may have done some volunteer work at community health fairs or volunteered at immunization program outreaches or done some work with STD outreach or Planned Parenthood, other situations where they have had exposure to it and have the bug that has bitten them in a sense to be able to pursue a career in public health and have an interest. This is that program for them. Okay? The best fit characteristics, the interest in public health, the demonstrated intelligence component of someone's background and the capacity for them to acquire new skills is going to be key. The last P of the best fit model is that this is a tactile program, a hands-on program. Nikki mentioned that this is an experiential learning program when she reviewed the mission of the program. It really does provide training and experiential learning. So those individuals who you've worked with in schools and programs in public health who have really acquired the skill sets but have the desire to go out into the public health work environment and actually work with the community, work with partners, actually get out there and put their hands on the actual work at hand is critical. It is a program that we have as far as the mechanism is to work with the host site supervisor, let the host site supervisor teach them certain activities, let the activities that they are taught then go out and be conducted, actually complete the work, and then the capacity of the associate to come back and then teach others how to do that approach as well. So let them see what is being done, okay, by demonstration or observation. Let them actually do the work. Let them actually put their hands on the work itself and actually implement the work and conduct the work and collect data, analyze data. And then as they master that over the 2 years and become more skilled at it, to be able to teach others what they have learned in the process. So this is really applying those theoretical principles of public health that they will acquire during the program. They don't have to come in with any basic understanding, but they'll acquire it through the program. They'll actually do the work, and hopefully will be able to teach others in a fashion that lets them transfer their knowledge to others in the program. Okay? Associates are expected to learn the structure and function within a public health program, whether they are at a state level, a local level, tribal, territorial level. They'll be expected to understand the structure and basic function of a public health program. They're expected to actually deliver public health services. They'll gain competencies in technical elements of carrying out a public health program under the supervision of a host site supervisor who is their day-to-day supervisor at the city or state where they'll be located, and under the official direction of their CDC PHAP supervisor as part of their official chain of command as a federal government employee. What I wanted to do next is just show you a couple of 30-second snippets from associates, and this is from our PHAP website that is in the public domain that you all will have access to. It is at www.cdc.gov/PHAP. That gets you into the main site of our PHAP website, which is the primary source of information for technical assistance, A, for locations who want to host an associate, and B, for candidates who are interested in learning more about PHAP and understanding what it's about. We want to play a couple of these so you can see at least 3 of the associates and their experiences. They're 30-second snippets. So if we can go ahead and play these, Sarah, and let our audience have a sense directly from hearing it from the associates.
So through PHAP, I was placed at the Cincinnati Health Department in the School and Adolescent Health Division, which operates a series of school-based health centers serving 33,000 students in the Cincinnati Public School District. This is important because Cincinnati actually has the 2nd highest rate of children in poverty in the country. So working in the school-based health centers has enabled me to be part of a network creating access to care for low-income students. I wouldn't have been able to do this anywhere else.
PHAP has allowed me to work on the 2014 Ebola response at the Minneapolis-St. Paul quarantine station with Dr. Arnold Fang. I was able to educate others on donning and doffing of personal protective equipment, as well as work with local jurisdictions on a tabletop exercise. Additionally, we worked with U.S. Customs and Border Protection on global health, as well as individuals coming into the country.
I think if you're interested in making a difference, I think the Public Health Associate Program is the best sort of tool to use to do that right out of undergrad, because it lets you really get down to the local level and understand public health at its core. And so I got the opportunity to do that by working in a sexual health program and working as a disease intervention specialist who really counsels and educates people about their sexual health. So I gained really important skills in communication and how to just, you know, work with people on a sensitive topic. And I think these skills have really set me apart from my peers, and they really have given me a strong foundation this early in my public health career, and they've given me the tools to continue to make a difference in my community.
Great, thank you, Sarah. That gives you a little bit of an actual view of the associates that come into the program and what some of them walk away with. Many of our associates will move on, and we'll talk a little bit about the disposition of the class that graduated in 2014 and 2015 most recently. You can see majority, over 50% of them, have just accepted a job right out of the program. solely working full-time as a full-time equivalent or FTE. If you look over to the third column, this adds another 1% that have taken a job or are pursuing an education simultaneously. So in 2015, the green bar looks at 52 and 12, takes us up to 64% are working, with 12% of those folks actually working and going back to school simultaneously. In 2014, 52% of those folks accepted a job, where 1% of those folks were working simultaneously. So these folks are highly driven. These are folks that are career driven, they are professionally driven, they're intelligent people, they have strong career goals, and so forth. Over the last couple years, we've seen more than 20%, as you can see, 32% in 14 graduates and 20% last year that have gone on to further education. Many of those folks are pursuing graduate degrees in public health. Some of them are moving on to MBAs or MPAs. Many of them have applied and accepted into PhD programs if they came into the program with their master's. We have a subset that have pursued their medical degrees and applied and have been accepted to medical school. Anthony Nixon, the gentleman that you saw in the video, is working at The Ohio State University in their laboratories preparing to apply to medical school next year, and has a very, very strong application and strong background in understanding public health and how public health fits into health and healthcare in pursuance of his potential degree in medical school. There's a handful of folks that will come out of the program, as you can see, 16% over the last 2 years, that really come out of the program and are really undecided, and that's okay too. PHAP is not a program that is a clear path for everyone. Some folks will come into public health associate program and have an interest in public health, and this really, public health may not be the actual career for them. They may enjoy the experience, they may get something out of the experience, but they may realize that what they get out of it is maybe public health really isn't the career for them, and that's okay too. This program is a training program to give folks the opportunity to pursue a career in public health should they have an interest and that's where they want to focus. And if they don't, then we are a success as well. But hopefully they have gained some very valuable skills and some valuable experiences over the 2-year duration of PHAP, and that will help them in whatever their next career step is moving forward. Let's talk a little bit, before we open up for questions, a little bit about the PHAP candidate timeline. We have 3 phases that I mentioned earlier in the application process. The application for associates will open up January 4th through January 8th of 2016. That is in a couple of weeks. Believe it or not, the holiday season in 2015 is coming to a close. So the first full week of January, Monday the 4th through Friday the 8th at 11:59 p.m. Eastern Time, will be the application period for phase 1 of the process. This application process is done through the federal government website called usajobs.gov, usajobs.gov. That is the portal for all federal government employment opportunities. Someone says, JT, why is it such a short application period? You've got 5 days for 3,000 people to apply. Well, as you can see, historically we had 3,000 plus applications over a 5-day period. So volume of applications are not what we need in order to look at the best candidates for PHAP. So if we were to open up longer, we'd probably get more applications, which many of you in your positions are probably in the same seat. You don't need more applications. What we're doing this afternoon is talking to you a little bit about the best fit characteristics to ensure that you can help us identify that subset of your constituents and your individuals that you work with and encourage them to apply. That is the first phase. It's a short application period. It's not a complicated application in the USA Jobs application process. It gets them in the system and gets the process started. They'll have to answer a few questions. There's nothing else that, as far as in writing, that will take them any time to prepare. They'll have to upload a resume, and they'll have to actually make sure that that is uploaded. What we're suggesting is this, is if you have candidates who are interested, they can get on to usajobs.gov now and actually start a profile. They will have to do that in January, but there's no reason they can't at least start the process early and setting up their own personal profile in USA Jobs. When January 4th to the 8th rolls around, they can then go in, respond to the announcement, and complete the application. It'll take some time for our Human Resources Office to sift through all the applications and identify those candidates that are deemed acceptable to move on to phase 2, which is the personal statement phase. In March of 2016, we will look forward to receiving the list of the candidates who have met the minimum criteria of acceptability from our Human Resources Office. We'll then reach out to a subset of individuals who have met the minimum criteria, and we'll ask them to complete a personal statement responding to 3 or 4 questions using the written word. It's no more than 750 words, so it is not a long, lengthy dissertation or thesis that we ask them to write or prepare. They'll have 5 days in the process as well, okay? So we will ask them, and we'll review their capacity to communicate using the written word. In April, we'll look forward to taking a subset of those who have excelled at communicating using the written word, and we'll actually do a Skype interview. We'll have a personal interview with a member of the PHAP program here in Atlanta, and we'll actually do an interview to help share a little bit more about the program in person or via Skype virtually with the candidate, and really allow the candidate to share some of his or her experiences with us, and really helping us identify if PHAP is the best fit program for them, and if they are the best fit for PHAP. We like to look at that as a two-way interview, where the candidate will look at PHAP and really contemplate whether this is the best program for them based on the characteristics of PHAP and what we've talked about today, and whether they are the best fit for PHAP based on some of these variables that we've provided you. Once we've identified the candidates who we have interviewed and ranked them, we're doing the same process in parallel with host site applications. That will also start in January. So host sites who are interested in applying to host an associate next October, which is when the class will start, will be submitting their application in the Fellowship Management System, or FMS. In early January, February, March, and April, we'll be reviewing those host site applications for acceptability and conduct a series of phased reviews, including our centers, institutes, and offices of subject matter experts, our staff at PHAP to conduct an objective review, and we'll also rank and rate the host site applicants. In May and June of next year, we'll then actually have completed a list of the candidates that we've accepted and a list of the actual host site applications that we will accept and match. We'll go through the matching process. We'll put together candidates who we would like to extend an invitation to join PHAP with applications from host sites who we think would be a good training and learning environment, and then make the offers to the associates. Like I said, the process starts in January. However, July, August, sometimes September, those matches will be shared back with the associate, and the candidates will be informed, and the host sites will be informed of which offers were accepted and matched. October 3rd of 2016 is a Monday, the first Monday of the federal fiscal year. This is the day the associates will be expected to report to their duty station or the city and state where their host site will be located to start their assignment. They'll stay on their assignment for the first couple of weeks of October. We'll bring them back to Atlanta for an orientation. We'll fly everyone back to Atlanta to headquarters here at CDC. We'll orient them, to the federal government, to the systems and processes as a federal government employee for the 2-year duration of the training program. We'll start to orient them to basic public health practices and systems, the infrastructure of public health, so they understand some of the basic components that we think are important before they actually dig into their work at the host site that they've been assigned and matched with. So that gives you a little bit of an overview of the timeline. We have some time left at the top of the hour, but what we've done is we reviewed a few things. A basic overview of what the PHAP program is, what it really is not, okay, focusing on the fact that it's a 2-year training program. There are federal employees throughout the process. This is a training program, not an employment program, so there is no guarantee of employment afterwards. And we've gone through the best fit characteristics, and hopefully you're walking away with maybe 1, 2, 3, and maybe a half a dozen names in your minds of individuals that you are working with that will meet the criteria and meet these potential best fit characteristics. One thing to keep in mind is that they will have had to receive their most recent degree by July 1st of this year, confirmed and in hand, and it has to be within the past 2 years. So if they have received a master's degree, for example, and they're receiving their master's degree this June of 2016, however, their bachelor's degree was in 2004, and they took some time off, then they are within the scope of acceptable criteria because their most recent degree they will have received within 2 years of starting the program. So it's their most recent degree that we're looking at. If there was a break between an undergraduate or graduate school, that's acceptable. We have a wide age range of our PHAP associates. So some are coming right out of undergraduate school, some are later in their careers, and some have looked at public health as a second career choice based on what they've experienced in the past. But it is 2 years within their most recent degree. Hence, it really is a training program. We don't expect someone to have years and years of public health experience to come into PHAP. This program isn't geared to them. This program is geared to that early career, entry-level public health professional with little to no public health experience. So we've talked about the best fit model. We've talked a little bit about the candidate timeline. I'm going to go ahead and open it and turn it back to Sarah to see if there are any questions that have come in on the chat or how we want to actually have the questions posed for the duration of the call. So Sarah, I'll turn it back to you at this point.
Sure. Thank you, JT and Nikki. We will now take this time to address questions. As a reminder, please submit your questions by typing them into the question box. I'll keep this up as well. The first question, where can we find out more information for host sites that want to apply to host an associate?
Oh, that's a great question. The PHAP website that we've given you the address to, cdc.gov/PHAP, that is the primary portal of information for both candidates and locations who want to have a host an associate. If you look down on the website, there'll be an information on become an associate, and then the next field down is become a host site. If they click on become a host site, that will take you to some of the characteristics of a host site that they should take into account. There are 2 40-minute webinars that we put forth. It's called PHAP 101, which is an overview of PHAP, and it really gives a basic overview of what PHAP is to those locations who really have never heard of PHAP. They don't understand what PHAP is. They may have heard about it but don't know much about it. It really talks about what we've covered somewhat here today through Nikki's points on helping orient potential host sites on what PHAP is. The more meaty and substantive technical assistance offering on the PHAP website is the PHAP 201, and that really talks about the co-star model, which are the 7 characteristics of a quality PHAP training experience. So should a host site be interested in applying to host an associate, we've developed a similar model called the co-star model with 2 R's at the end, hence 7 characteristics of a quality PHAP training experience. They talk about things like core competencies, the C. The work activity should align with the core competencies of PHAP, which are those 9 domain areas that Nikki mentioned. The O, are there opportunities for advancement over the 2 years? So there's iterative and progressive building of skills over the 2 years. Not that the associate is doing the same work repetitively once he or she's attained the skills in the first 2 or 3 months and just repeating that as a workforce gap mechanism. So that 201 goes over those 7 characteristics that are worth their weight in gold in helping a host site contemplate and decide if they want to apply, number 1, and if they do, to walk them through the process. We're encouraging folks who are at host sites to review that and prepare the work activities and the model now. When the application opens in January for our host sites, it will not walk them through the process to develop a quality experience. They will have had to have some forethought and actually done some contemplation and some strategic thinking at their location before responding to the questions on the application in January for host sites. But the PHAP website is a good portal of information for host sites interested in applying to host an associate.
Great. Thank you so much, JT. This question has to do with candidates. What percentage of accepted candidates are bachelor's level only or baccalaureate degree, have baccalaureate degrees only?
That's a good question. This past year, for those associates that came in on 2015, the class started in October, about 35% had master's degrees. The remaining balance, minus about 2 or 3% here and there, had bachelor's degrees. So the majority do have bachelor's degrees. Upwards of 60% or so, 50–60% have bachelor's degrees. Some of them in public health or a science-related field. Some of them do not have a science-related field. It's in liberal arts, but they have the experience with public health through some mechanism. They have the passion for public health, and they apply and are in the class. So the majority come in with bachelor's degrees as entry-level public health professionals.
Great. And then following up that question, what percentage of accepted candidates majored in public health or a similar field, so actually have some educational experience with public health?
That's a good question, and statistically, I don't have that at my fingertips. There's, I want to say it's a predominant percentage, but the actual number I don't have. Maybe we can share that back with you, Sarah, and actually post it on a website for some future reference. Many of the folks do have undergraduate degrees in public health or master's degrees in public health. I wouldn't say the majority, but I can't give a percentage, and I'll have to do a little bit of research and share it back with you somehow to put back onto the website.
Okay, great. We can certainly do that. There are a few questions about timelines, about if people have graduation in August or December or October. Does their graduation date matter in order to start a program? As long as they're graduated by the start date in October, are they permitted to apply?
Yeah, that's a good question. The actual receiving of the degree has to be in hand and confirmed by July 1st of this year. So if they're not graduating until August or September for whatever reason, based on the structure of your program's cycles and graduations, then they're not eligible. They have to have received a confirmed degree by July 1st of this year. Now, they're eligible next year to apply, and they're even eligible the year after that because it's got a 2-year window. But for those individuals interested in applying in 2016 to start the class in October, they must have received and confirmed their degree by July 1st of this year.
Wonderful. Thanks so much for clarifying that. There are a few questions about how many Skype interviews are conducted and how many references candidates need and when they're due. So a couple of different questions there.
Let me answer the second question first, and then we'll talk about the first question second. We don't take any references for PHAP candidates. What we look at are really the skill set of an individual, and meeting the minimum criteria that Nikki outlined as far as having a 4-year degree, a 3.0, a U.S. citizen, and within a permanent resident, and being within 2 years of graduation as the minimum criteria for Pathways, the recent graduates program criteria. We then look forward to their own individual capacity to communicate in writing and how they can convey communication skills and information and messages via written and oral communication. We found that many references, we're going to get the wonderful people that walk on water, as we all would like to do when we get references for ourselves or give them for others, but we look at really the essence of an individual and his or her experience and background to communicate effectively, and their experience with socially and culturally diverse individuals, and their flexibility, their adaptability, their creativity, their working in a dynamic environment through the process. So therefore, we don't take any references on behalf of the associate and their application. And I forgot the second part of the question I was going to answer first. Oh, how many Skype interviews? Skype interviews, yeah, thank you.
Yep.
The Skype interviews. Well, last year we actually piloted the process, and it was a huge success. We have a subset. Last year we invited about 450, 460 individuals to participate in Skype interviews, of which we selected 208 that were matched with a host site. We have a number of alternates that we also include in that list, but we had a final class of 208 having interviewed about 460, 470 individuals via Skype. And 99% of those were successful interviews. If you look at the technological ability to link up, there was a few that had some technical difficulties. Some were overseas and the internet connection was less than optimal, but it was very positively well received from those candidates that participated in the interview. They can actually see us, we can see them. It was a little bit more of a dynamic conversation and interaction, which again, this is a two-way dynamic process that we encourage the associate to learn a little bit about PHAP, get an understanding of leadership and the supervisors here at PHAP, and learn, is this the program for them or is this not a program for them, and vice versa. So upwards of about 460 Skype interviews were conducted last year.
Wow, that's pretty impressive. We have, it looks like, one more question. How diverse are the PHAP associates in recent years, specifically with regard to racial, ethnic, and socioeconomic status?
Sure. That's a great question. And one of the things based on the population that public health associates serve as far as diversity is very key. We collect no demographic information through the application process. When associates come into Atlanta for their orientation, we do a survey that is self-identified variables that they have the option, it's voluntary to collect or not, they don't have to submit it, to actually look at diversity and racial ethnicity and cultural diversity of the class. We find that over 51% have self-identified in a racially diverse component, an aspect of how they would describe themselves, whether it's multicultural, racial, ethnically diverse, but over 51% represented a diverse population across the board. And this is something that comes forth not even with our effort to recruit from a diverse population. We have a couple of pilot projects that one of our colleagues is leading, who is looking at American Indian, Alaska Native host sites and candidates, as that's a significantly underserved population. So we're doing some targeted recruiting in that population. However, our goal is to look at the best fit candidates, and they really do, the diversity kind of raises itself, and we see that the classes, over 51% have self-identified in a diverse population category across the board. So we're extremely happy about the diversity of the class.
Wonderful. Thank you for that specific answer, JT. It looks like we've answered all the questions, and we're coming up right on the hour. So thank you, JT and Nikki, for your presentation today. And thank you all for joining us on the line. Just a few closing webinars or slides. As a reminder, this webinar has been recorded and will be archived on the event page later today, most likely, along with the handouts. They'll be available online as well. And if you have any questions, please don't hesitate to contact webinars@ASPPH.org. And please don't hesitate to check back with ASPPH.org events for upcoming events in the new year and other webinars that may be of interest to you. And lastly, please do check out registration opened up today for ASPPH Undergraduate Public Health and Global Health Education Summit and the 2016 ASPPH Annual Meeting. Thank you all very much and have a wonderful weekend.